Hi folks, Dr. Ed Beyer. Today we're going to be talking about how your gut influences the brain. Now, you could just do a Google search on this gut-brain connection, brain-gut connection, but the scientific literature is just loaded with information on how the gut and the brain are intimately connected. And what we see a lot of times in our patients is they got certain disorders in the gut that lead to depression. We could also throw in other cognitive changes in there like anxiety, brain fog, memory loss, ADD, lack of motivation, mood swings, all of that. It all depends on what area of the brain gets affected by the gut problem. Now, one of the things that really influences our brain is something called SIBO, or small intestinal bacterial overgrowth. This is a condition where you're having an overgrowth of normal bacteria that reside in the small intestine, and it's causing a release of chemicals into the bloodstream known as cytokines. And these cytokines cause inflammation throughout the body. They can cause joint pain, etc. But these cytokines from the overgrowth of bacteria in the small intestine will easily cross into the brain, and they react with the brain's immune system, causing inflammation in the brain. And if that inflammation of the brain is in your frontal lobes, you're going to have depression. Now, I'm not talking about I want to kill myself depression, but like lack of motivation and brain fog and life is just not as fun as it used to be. If you're having any of those symptoms, they can be attributed possibly to this SIBO, small intestinal bacterial overgrowth. There's a test that we can do to detect if you have this, and if so, what type, and we can almost in all cases eradicate it through lifestyle changes and through certain supplementation and enzymes and replacement for stomach acids. And that is one of the main causes of SIBO, is not producing enough acid in the stomach. We see this a lot in our patients. The pH of the stomach should be at 2.0, which is really acidic. And if it's not, then you're not going to get the pancreas to release sodium bicarbonate, which takes the 2.0 and actually changes it to a more alkaline state. When we don't get the pancreatic function to be proper due to the lack of stimulation from the stomach acids, sodium bicarbonate and your digestive enzymes will not be released, and it changes the whole pH in the distal part of the small intestine, the far end, and certain bad bacteria like that, and they overgrow and they produce the SIBO and then the subsequent changes in the body and brain. I'm Dr. Ed Beyer. Hope that helps. Have a great day.